This video contains questions and answers formulated to easily understand about peptic ulcer. Information is taken from page 1117 of Bailey and Love's Short Practice of Surgery, 27th edition. Duodenal ulceration. What are the recent trends in the incidence of duodenal ulceration in resource-rich countries? The incidence of duodenal ulceration has decreased in the past 2 decades. The frequency of elective surgery for duodenal ulceration has also fallen. Dyspeptic patients presenting with duodenal ulcers during gastroscopy are now uncommon. Widespread use of gastric antisecretory agents and Helicobacter pylori eradication therapy may contribute to the decreased incidence. What changes in demographics have been observed in patients with duodenal ulcers? Peak incidence now occurs in an older age group than previously. Duodenal ulcers are still more common in men, but the gender difference is less pronounced. The demographic changes mirror shifts in the epidemiology of H. pylori infection. How does the incidence of duodenal ulceration differ globally? In Eastern Europe, duodenal ulceration remains common. In some resource-poor nations, where duodenal ulceration was once rare, it is now being observed more frequently. The increased incidence in these regions appears to be related to H. pylori infection. Pathology of duodenal ulceration. Where do most duodenal ulcers occur? Most duodenal ulcers occur in the first part of the duodenum. What are the features of a chronic duodenal ulcer? A chronic ulcer penetrates the mucosa and extends into the muscle coat. This penetration leads to fibrosis, or scar tissue formation. Fibrosis can cause deformities, such as pyloric stenosis, which is the narrowing of the pyloric canal. What happens when a duodenal ulcer heals? When a duodenal ulcer heals, a scar is observed in the mucosa. Can more than one duodenal ulcer occur at a time? Yes, there can be more than one duodenal ulcer. A combination of both anterior and posterior ulcers is called kissing ulcers. What are the tendencies of anterior versus posterior duodenal ulcers? Anterior ulcers tend to perforate. Posterior ulcers tend to bleed, sometimes by eroding into the gastroduodenal artery. What is the appearance of extensive duodenal ulceration? In some cases, the entire duodenal cap may be ulcerated and devoid of mucosa. Does a giant duodenal ulcer suggest malignancy? Malignancy in this region is uncommon. Surgeons can be confident that giant duodenal ulcers are usually benign, even if palpation suggests otherwise. This differs from the situation in the stomach, where malignancy is a more significant concern. Histopathology of duodenal ulceration. What are the microscopic features of a chronic duodenal ulcer? Destruction of the muscular coat is observed. The base of the ulcer is covered with granulation tissue. Arteries near the ulcer show changes characteristic of endarteritis obliterans, which is the inflammation and narrowing of the arteries. Nerve terminations may be visible among the fibrosis. What is important when interpreting the pathological appearance of a healing ulcer? Epithelial downgrowths in a healing ulcer can sometimes be misinterpreted as malignant invasion. This is unlikely to be significant in duodenal ulcers, where malignancy is rare. However, in gastric ulcers, misinterpretation is more critical due to the higher risk of malignancy.